as I am a fellow employer, and like you, we're always looking for ways to attract the best talent out there and have programs in place and benefits and systems that are attractive, yet don't necessarily break the bank, as it were. And for the last, gosh, too many years to mention, in addition to being part of Homeland Security and having spent a good number of years with AstraZeneca, both domestic and globally, I was the head of HR for Montgomery County government while Duncan was I don't know if any of you remember County Executive Doug Duncan. Does that bring back any memories? Yes? I had the opportunity to work with Doug for a number of years, and I know, and so I work quite a bit with the community and employers in the community, looking at ways to, not only to look at ways to attract employees from the recruitment and all of that, but really from a benefits perspective. And only to find that when I went to the private sector, the same challenges were there as well. You know, how do we make ourselves, how do we make the organization an attractive one, while at the same time keeping an eye on the cost and the challenges that we were having, you know, with the cost increases that were happening in the healthcare environment. So I am now with Adventist, and I'm delighted to have been with the organization for about a year plus. I was on the board of Adventist prior to coming to the organization, so I have a real passion for what the Adventist healthcare system is trying to do in the community. And like David and Asbury, we think of ourselves as a partner in the community. And how many of you are familiar with Shady Grove Hospital, Washington Adventist? How many of you have been to Shady Grove Hospital, Washington? How many of you have been patient? I fell the other day and ended up going in a not very flattering way into the emergency room, and it was kind of embarrassing when you're an executive with a company and you go in and just didn't feel so good being a patient, but they treated me well. But in addition to having the hospitals and having the focus on the sick care, Adventist really has more of a focus and an eye towards a population-based care, and how can we help the community where we have not only the two acute hospitals that you're familiar with, Shady Grove and Washington Adventist, but also we have a rehab hospital right next to Shady Grove, as well as a behavioral hospital as well. We service over 450,000 of our fellow citizens in the community last year, and we're very proud of our presence here. We've been around over 100 years. Believe it or not, Washington Adventist was built 100 years ago, about 104, 105 years ago. LifeWorks Strategies, then you've heard David mention as one of the sponsors, is in fact a member of the Adventist organization, and through the LifeWorks Strategies, we actually serve the corporate and the business community, if you will, through many of the services that we provide, whether it's flu shots, wellness initiatives, EAP, employee assistance programs, and so on. So I feel like I'm doing a little bit of an announce or marketing here. I'm not trying to, but the reason I put it is to really to contextualize that the way that we looked at our programs for our employees, we have a little over 7,000 employees in the company, it's really not too dissimilar to the way we view our role in the community, and that's where I wanted to kind of bring you to, if I could. So that's who we are. We are a faith-based organization, and think of ourselves as having that as kind of as the North Star in the way that we provide care. But again, it's about being part of the population and making sure that we can actually prevent people from getting sick, rather than taking care of them when they do, but it's really about the prevention part. So how does that fit into the ACA, the Accountable Care Act, and what are we doing for our own employee population? Hopefully it serves as a model to you as well. And I think my colleague Kevin will speak after I do, and then I'll stay around if you have any questions for afterwards. So what does the ACA do in terms of the wellness programs and opportunities therein? And I think, I don't think it's a surprise, because certainly the President and anybody that will talk about the ACA or healthcare initiatives in general, it's really about how do we keep people from out of hospitals, how do we keep them healthy, how do we keep them from, you know, smoking and doing the things that are probably going to be detrimental to their health. So they are, the Act allows for, in fact, incentivizes organizations that put in programs that to help folks stop smoking, take health risk assessments. I don't know how many of you, do any of you have health, do you do HRAs in your own organizations? Do you know what a health risk assessment, when you ask employees to, and so on? So and I'll come back to that a little bit more, because it has been really important in our own organization. And again, generally participating in health screening. So the Act allows for that, encourages that, and allows for incentives, discriminatory incentives. It's actually giving people discounts that for participating in those things, while you're not giving the same discounts to somebody else. The law, as you know, always tries to protect and treat everyone equally. Here they're saying, you know, this is so important to us, to the savings that we may achieve in healthcare overall, and so we want to make sure that we provide incentives. It also provides for outcome-based, and this is a little bit trickier, because we want to make sure that we're not creating disincentives, if you will, for people who may not be able to achieve certain goals. So the law says, okay, you can do an evidence-based or an outcome-based incentives, but you need to make sure that you provide people, for instance, it's great to not smoke, but you also need to provide people the opportunity to take a smoking cessation program. So you can't just do it only on the basis of somebody's not smoking, but it has to be also, you have to provide the opportunity for a program like a smoking cessation, or achieving like a certain cholesterol level and so on, but you also need to make sure that you provide, you know, certain educational opportunities and so on. So the law is good for the employer in that regard, because we can incentivize, but it also protects the employees to make sure that we are doing everything that we can to help them achieve whatever we're trying to get. The other thing that the program allows is, and I think this is an area where also, you know, it's, you know, as a healthcare provider, it's a little bit of a schizophrenic conversation, because on one hand, the law allows for a lot of services that for which organizations like hospitals and so on don't necessarily get compensated, or insurance companies, but on the other hand, they're good for the employee, like, you know, a lot of the programs around the annual physical or regular well baby and stuff that is sort of commonsensical to us, but the law is now into law, and that's a good thing. The women's preventive care, well visit, and so on. So for us, basically what we've done as an employer is that we have taken the law and said, okay, what are the features that we're required to do, and certainly have done that, but also what are the things that are good for us to do as an employer, and have incorporated that into our programs as well. And I think Kevin is going to talk a lot more about the ACA and all the specifics of the law, and and I'm going to leave that to him. It also allows you to, you know, under the HIPAA requirements, it allows you to do actually, as I said, financial incentives. And you can do about 20% reduction of the coverage, which is actually, it's really a lot more of 20%, because it's 20% of the overall cost. So it's not just 20% of what the employee pay or the employer, but both the employer and employee pay. So it allows for quite a bit of savings in that regard. We do a lot of prevention of disease management and disease prevention. And I'd be curious, do any of you have a lot of these programs in place, disease management and prevention in your own health? Most of you are employers, correct? I believe the bulk of you are either have your own companies or running or managers and leading companies in the area. So I don't know how many of you are doing a lot of health promotion programs, but that's something that's certainly very, very allowed. You do have to allow the employee to qualify once a year, so it's not like you, if you say, okay, Marta, you smoke, so therefore you don't qualify and you're done. Next year I have the opportunity to come back in and have the opportunity to tell you what I'm doing, whether I'm taking smoking cessation and so on. You also have to provide for similar situated individuals, you know, so if somebody has a medical condition, for whom won't use smoking, but for whom they can't weight reduction or diabetes or something it's not reasonable, then that individual also can in fact receive a waiver, excuse me, if you will. And so I think that's a protection that the law provides. Things like GNOW, the Generic Information Non-Discrimination Act, those protections are still in place. So you couldn't ask in your HRA, in your health risk assessment, you couldn't ask questions about family background, family health issues and so on, because the law does not allow you to discriminate, regardless of the incentives that it allows for. American with Disability Act, of course, still prevails, so you need to follow that. Age discrimination and all the specific screening and protection. So while it allows for incentive, it doesn't allow you to violate other parts of the regulatory environment that protect employees. But yet there's quite a bit of room, and I'll tell you what we have done. So we have basically we have really fully integrated our medical programs with our wellness programs, and we do quite an in-depth analysis of our employees' claim data, and obviously not violating any HIPAA or individual, but in the aggregate we look at health data, and we actually stratify the workforce. So we said people who have higher risk of diabetes or cholesterol or what have you. Those individuals we offer programs, and in fact in some instances for people who are high risk and who are in most instances you're probably the top spenders in your health benefits. But for them, we've actually put a nurse, we put a personal health nurse to work with these members, and the nurses work very closely with the doctors, with the patient-centered. Is anybody familiar with the patient-centered medical homes? You familiar with that? So to work with the patient. We've actually, by stratifying the workforce, we've been able to not only to return people to health and get it to either moderate or healthy, but we have actually reduced the cost, and you'll see that in a slide or two. But we're very intentional about the programs that we offer through LifeWork Strategy. LifeWork Strategy is in fact the provider of health and wellness for our own employee population, as well as the EAP, the Employee Assistance Program. We offer programs around the coordination with the doctor. So we basically have we're self-insured. Any of you are self-insured where you have a little more flexibility? Some of you are self-insured. So basically what we have done is we've created our network of doctors and asked them, or have incentivized them to become PCMH, so sort of patient-centric, and work with them to make sure that they're working with the doctor, with the patients, and they're working with the nurses. Have created sort of a continuum of care with people, and also have partnered with sports and health, and I don't know if you're a sports and health facilities. And our employees actually get a discount for being part of the sports and health. And we are putting at sports and health a nurse. We have nurses that work out of sports and health, so an employee wants to have a checkup or whatever, they can do it at sports and health facility. We're actually putting in rehab, some of our rehab, so they can do physical therapy at the rehab, the one here at Rio, at the sports and health at Rio, so really to allow for additional ease of access, if you will, for our employees, but also to incentivize employees to use services in a wellness environment, rather than it be in a sick environment, being in sort of in a wellness environment. We offer about 25% discount for our employees who participate. You have to both participate in the HRA as well as demonstrate that either you don't smoke, and we just ask for attestation. Your employees tell us that they don't smoke. We don't do smoking screening or anything like that, but we do provide for benefits in that regard. We ask in our HRA, we do look at like cholesterol and diabetes and things like that. And like for instance, we do have not like everybody else, an aging population, a lot of diabetes, prone to diabetes. So I think we're doing a lot of programs around diabetes prevention and maintenance and so on, as well as cholesterol screening. We offer a lot of programs, and free flu shots, lifestyle modification, The personal health nurse, I think, is probably the one lever that you can pull from a medical health perspective and have the most impact in terms of not only the individual's lifestyle, but also the cost to the program. And we have testimony from employees who are now, will write to us, and in fact we publish them, saying thank you for the opportunity to work with a nurse, and thank you for the opportunity to, go to sports and health. Has made a big difference in my life, and I was this and now I'm that, and I mean really, really heartwarming stories that not only are you doing something that's good for the company, but you're doing something that's good for the employee, and that's always a good thing when, sort of a win-win, if you will. This is sort of where we were in 2009, where we had, quite an expensive program. As I said, a small number of our employees were spending a lot of the money, the cost in healthcare. So we basically put in our patient-centric medical home, the personal health nurse, and started working with the employees. And we actually have reduced our per member per month cost from around $1,900 a month down to about $1,400 in 2011, and it has continued. But that's the last data that I have, point that I have. I mean, that's over 28, almost 30% reduction, and we continue to reduce. So I think these are some of the things that we actually make available to employers as well. And the way you can do this is because of a very robust informatics, so a very robust data warehousing, data that allows you to do really great analysis of claims and so on. That makes that helps you be able to make good decisions and the right decision for the employees. On a sort of on the book of business, a comparison of our cost to trends, as you can see, we've been able to maintain. We're the blue line in here. We've been able to maintain the cost for Adventist healthcare for 7,000 employees compared to the national average. And that's not depending on the size of the organization, that could be big dollars. This is what we're actually calling our effort is My Health Place. It's a very employee-centric or member-centric effort. We actually provide for we've created a website that the employees can go to, and it's called My Health Place. And in there, the employees have a portal where they can get all the information about their own health data, their claims, when did they go to the doctor, they went to the doctors, and the claims, and what medications they're taking. All of that information is readily available to the employee. There's a lot of information around education, around disease management, and so on. The doctors have access to the website, so they can get access to the data as well. So doctors can go in and sort of look at their own their own clients or their own patient data and mine the data as well and find about what medications they're taking and so on. So it really helps with the challenges that you may have around information sharing and so on. We also have a network of relationships with, of course, the hospitals, our own hospitals, for sure. The pharmacies, we have relationship like with Walgreens and so on. That not only do our employees can go get medications. I mean, they can go anywhere, but we have special relationship with them, where Walgreens would actually call our employees. If they've had an incident, or they've had an event, they've gone to the hospital, they've had whatever, they have their medication they're taking, they will actually follow up with it to make sure that people that are, the members are adhering to the meds, because if they do that, then they're going to, prevent getting sick. As I mentioned about the relationship with the fitness center. The doctors working in collaboration and incentivizing the doctors in our network, incentivizing them to work with the nurses and the members. So it's not that just Marta Perez went to the doctors once, thank you, I'll see you a year from now. It's making sure that these doctors are now become part of my total overall healthcare delivery system. And then similarly, we do the programs that we provide in the organization around the person, the nurse, the wellness coaches, lifestyle modifications, the biometrics, the EAPs, financial assistance, we provide all of that. Again, it's how do you take all of the elements, the things that impact an individual or an employee or a member's life, in ways that can adversely impact them, and how do you help them make better? And then we get things, we improve the claim processing, the third-party administrator. We also have a third-party administrator that's a partner in the whole thing. So it's basically creating an environment where employees see all of these things as being connected and working in their favor, or they're advocates of the employees, rather than seeing a doctor's visit and so on as episodal, episodal events that are not necessarily connected. So we think by integrating this, by creating this kind of fully integrated and positive environment around wellness and making sure that you're doing the right thing and you're staying fit and you're taking your meds. And if you have if you have a condition, and sometimes we get really, really sick, making sure you have those relationships with the hospitals as well. And in the hospital, when you are discharged from the hospitals, the nurses will reach out to you to make sure that you're doing whatever it is to avoid the readmission, because as you know, the law, and I don't know if Kevin, if you'll go into that, the law also talks about it. You can't, tries to avoid readmission so people don't have to come back into the hospital, certainly for the first 30 days. So we put nurses to work with our members. We do it with all the patients, by the way, at Washington and Adventist, but with our members, to make sure that that they see that we care for them. Staying completely, non-invasive in terms of people's privacy, and if folks don't want to participate or whatever, that's fine. But we try to make it as a very positive. So as employers, I certainly advocate for creating that kind of environment in your own organizations, because I think at the end, not only does it pay, as I said, financially, but also it's a good thing for employees. I think it helps employee engagement, and overall makes you a more attractive employer. Life work strategies, as I mentioned throughout my comments, we provide a lot of those services through life work strategies to other employers in the region. And some of you may very well be clients of life work strategies, at least in some parts of, we offer My Health Place as an integrated service delivery model, but also there's a kind of as a menu, you can pick if you just want wellness or EAP or whatever, you can also pick from that. So that's sort of an example of what it looks like, and taking advantage and leveraging the ACA and the incentives created therein, and as well as all the other requirements of the law, and applying them to an organization which is a relatively large employer in the region, and hopefully we can be a testament that good things can happen even when you're spending and doing things that the law requires. So thank you for your time. Thank you.
Thank you so much, Marta. All right, now it's my pleasure to introduce Kevin Yang, Chief Information